Hello. Today's lesson, we are going to be talking about, am I a good candidate for breast augmentation? This specific lesson is for people who are trying to figure out if they are a good candidate and what they need to do to talk to their surgeon about breast implants. Now, according to the American Society of Plastic Surgeons, the following list has been displayed for consideration. Number 1, in general, you should be in good physical health. This means no active infections, untreated cancer, or serious illnesses. If you have medical issues, it's important to discuss them with your surgeon so that he or she can help you decide whether or not breast implant surgery is suitable for you. Now, number 2, if your breasts are sagging, flattened, elongated, asymmetrical, or lacking adequate cleavage or volume, there is a good chance that you're an excellent candidate for this surgery. Number 3, most surgeons prefer that you do not smoke or consume significant amounts of alcohol. Number 4, because this surgery can permanently alter your appearance, it's important for you to be in a healthy frame of mind when you decide on this surgery. Number 5, while this is a surgery that will change how you look, it's important to remember that it cannot fix body image issues or give you a wildly different appearance. You should maintain realistic expectations and listen to your surgeon's honest assessment of your goals. Number 6, the best candidate for breast augmentation understands the risks as well as the rewards. The surgery is generally considered safe and implants are FDA approved, but with any surgery, there are some risks. Number 7, you understand that breast enhancement should be done strictly for yourself, and because you believe it will increase your own happiness or confidence. You should never get cosmetic work done because someone else wants you to. Number 8, you should have the ability to properly rest and recover post-surgery. You will not be able to perform certain tasks or do any heavy lifting, so it's important for you to have help in place. Number 9, for saline implants, the FDA requires you to be at least 18 years old. If you want silicone implants, the minimum age is 22. You can find this on plasticsurgery.org. Now, let's address this surgical criteria that was put out by the FDA. Number 1 is be in good physical health. So it's very important to understand not only your current health, but your family history. One thing doctors do not address is the family history of patients. I believe it is important to look at family history. In my family, I have allergy, autoimmune, and neurological issues. This was a triple threat for me. It would have been life-changing if a surgeon had considered my future health issues based on my family history. Number 2, having saggy or underdeveloped breasts. Now, I think this is the reason that most women consider breast implants because they do have saggy or underdeveloped breasts. Many women struggle with hormonal imbalances, stretching from nursing, weight fluctuations. Now, there are people who decide to get them because of social pressures, but it's important to understand the reason why you are considering breast implants. Number 3, no smoking or excessive alcohol use. With any surgical procedure, you are at risk if you smoke or drink heavily. Number 4, be in the right frame of mind. Now, you need to ask yourself, why am I getting larger breasts and why they're important to you? Is it because of social pressures, self-esteem? Do you think about breast implants often? Now, I understand how difficult these questions are, but you really need to ask yourself them. Number 5, realistic expectations. I think many women do not understand that breast implants will change the way you look at your breasts, but not change the way you look at the rest of yourself and feel about yourself. Number 6, risks of surgery and breast implants are safe. This is where I feel surgeons are failing us. They do not explain all the risks or scrutinize black box labels on breast implants. Make sure you bring all your questions. If the surgeon tries to soothe your uncertainty, most likely they just want your money. Number 7, getting implants for someone else. I know there are people who are doing just that. I was one of them. I thought it would help my marriage when in fact I lost a lot of precious time with my husband and family. Number 8, you need support after surgery. Now, recovery can be very difficult when getting breast implants. Your breasts will be inflamed. You will not be able to lift anything heavy for a while. If you're a stomach sleeper, it will be difficult to find rest because you cannot lay on your stomach. Number 9, age requirements for breast implants. With the pressure on young adolescents these days, it's good that we have an age requirement. Now, the FDA does require a black box warning. So a patient decision checklist and a patient information booklet brochure specific to the breast implants that should be provided by manufacturers and given to patients prior to implantation. I left a link there for you so you can look at it yourself. Now let's discuss the maintenance of breast implants. According to the FDA, breast implants are not a lifetime device and each year increases the risk of complications. It is recommended that breast implant patients do the following maintenance. Number 1, for asymptomatic patients, that means patients who do not have symptoms, the first ultrasound or magnetic resonance imaging, MRI, should be performed at 5 to 6 years post-operatively, then every 2 to 3 years thereafter. Number 2, for symptomatic patients, so those who are having symptoms, with equivocal ultrasound results for rupture at any time post-operatively, an MRI is recommended. So if you're having symptoms, go ahead and get an ultrasound, and then an MRI is recommended if you have a rupture. Number 3, it is not recommended to sleep on your stomach or lay on your stomach for any reason. Number 4, it is not recommended to put any blunt force on your breast implants. Number 5, it can be more difficult to do sports and heavy lifting. Number 6, you might have more back pain with extra weight. I know I experienced this. Number 7, your lungs may have a more difficult time expanding. Number 8, you need to replace breast implants every 5 to 10 years. And number 9, need to be tested each year for chemicals that are released by breast implants. There are several chemicals and heavy metals that off-gas and leach out into the system that are coming from the shell of breast implants. So most of this information was found in the FDA guideline for both saline and silicone breast implants. I have a link there that you are welcome to download, and let me know if you have any questions.